All parties involved in the Clarkson buyout deal held a university-wide meeting Tuesday to clear the air, including Nebraska Medicine.
KETV Newswatch 7's Madison Perales was at the meeting and joins us live in the newsroom. Madison, what was the discussion about?
Quinicia, although Nebraska Medicine's president says the hospital has a lot of healing to do, the common theme throughout the meeting is how all players have a shared vision for this deal and the future of this healthcare system.
It's regrettable, it's unfortunate how we got to this point, but we really need to focus on moving forward together.
Nebraska Medicine CEO Dr. Michael Ash shows a united front with UNMC Chancellor Dr. Deli Davies, who Region selected as Nebraska Medicine's interim board chairman.
We're going to be looking forward and we're not looking backwards. We're aligned in our shared mission.
Clarkson Regional Health Services CEO and newly installed vice chairman of Nebraska Medicine's board, Bill Lydiot, also cleared the air about the buyout.
Essentially, the bylaws should not change materially at all.
Ash, who opposed the deal from the beginning, bands together with the players, saying the fundamental question about governing structure was answered.
The day-to-day management, including the financial management, is under control of Nebraska Medicine, and that's not going to change.
Ash further adding Nebraska Medicine will control employment and payroll. Bill Lydiot says Nebraska Medicine's interim board's role is simply oversight.
If management is running things well, then stand out of the way.
Ash still has some lingering unanswered questions like funding flow.
And in fact, we haven't had any of those discussions yet.
As for the former Nebraska Medicine board members, Davies says there's some work to do.
That was something that we have to live with, and we have to, again, part of the healing that we talked about here has got to be that.
There's still an active Nebraska Medicine lawsuit against the Board of Regents and Clarkson Regional Health. And in the meeting, Dr. Davies said the attorneys are still working through it and the right time comments will be made. Back to you.